Hi, my name is Alison Lightbody. I'm one of the advanced physiotherapy practitioners for First Community, specialising in spinal pain.
And I'm Praveen Inaparthi, one of the spinal surgeons at East Surrey Hospital.
We've put together the Better Backs programme online, which is currently run in our physiotherapy outpatient department. I hope you find this useful. As well as the exercise programmes, we have some really informative education sessions to help you manage your symptoms better. We have devised quite an extensive exercise programme. Do not feel you need to do all the exercises, just pick and choose what is suited for you. If you are unsure as to whether you can undertake an exercise programme, then please seek medical advice. Also, if you do undertake this exercise programme and get worsening symptoms, then also seek medical advice. Sciatica is basically pain in the leg stemming from the back due to compression of the nerves. It's pleasing to note that most people suffering with back pain, with or without sciatica, improve without the need for invasive intervention such as surgery or injections.
Absolutely, Alison. Around 6 out of 10 would improve within 6 weeks and up to 8 out of 10 by 12 weeks. And even the NICE guidelines, the National Institute of Clinical Excellence guidelines, which came out in 2016, suggest the best treatment options, initial treatment options for back pain with or without sciatica would be pain management, activity modification and physiotherapy.
In very rare circumstances, you may have symptoms that require urgent medical attention, in which case then I do not advise that you participate in this Better Backs programme. These symptoms would include a bladder and bowel dysfunction, such as loss of bladder and bowel control, as well as a loss of sensation when you pass urine, or a loss of sensation when you have sexual intercourse. Any loss of sensation when you wipe around that region, around the buttocks and the genitals, as well as leg pain affecting both sides with numbness and weakness.
Along with that, if you have any fever, you feel unwell, you have a history of loss of weight, appetite, night sweats, severe pain at night time, then again you should certainly seek medical advice. Exercises are the first line of action for management of back pain, which is well supported by the NICE guidelines, as I mentioned earlier in the video. I see great benefit, great results with regular exercises for back pain management.
I would 100% agree, and it's backed by a huge amount of evidence that exercise is really beneficial. There's a lot of focus on us strengthening our core muscles to help with back pain, and whilst this is helpful, actually strengthening all of our muscles is really beneficial, and the Better Backs class does focus on all muscle groups. There's not a huge amount of evidence to support one exercise over another, and actually just being fitter is more beneficial. You will find that exercising sometimes does cause more pain, and this does not mean that you are causing more damage. It is important to pace your programme, so start at a low level and build up gradually. If you pace it appropriately, you will find that you will recover faster and progress more in your rehabilitation.
Sometimes I do see patients who have flare-ups during their exercise regime. But for those situations, what I suggest is just to slow down, take pain relief, but not to stop. And once the pain starts improving, gradually build up your exercise regime again.
We frequently get asked this question in physiotherapy, and the difficulty with an MRI is that it's not always helpful. An MRI will bring up a lot of changes within our spine that is often present in people that don't have any back pain or sciatica at all. These changes would include changes to the disc, such as disc bulges, or arthritic change within the spine.
I keep getting asked this question frequently. Yes, in situations like the critical symptoms and signs which we discussed about earlier in the video, those situations the scans need to be done urgently. Otherwise, MRI scans would be indicated mainly if there is an indication for injections or surgery or intervention. This is a common question I get asked. As I mentioned earlier in the video, the first line of treatment for back pain with or without sciatica would be pain relief, activity modification and physiotherapy, which is best provided in the community by the musculoskeletal team. If you have already gone through the Better Backs program and your sciatica or leg pain has not settled and is restricting your activities, then your physiotherapist may refer you on to be seen by a spinal surgeon to discuss further treatment options like injections or surgery.
Exercise has been shown to be really beneficial even in the long term, so I suggest you keep going with these exercises even when your back pain or your sciatica has improved. If you keep going with these exercises, then your back pain is less likely to reoccur, and if it does, it's shown to be less severe. It's worth noting that these exercises will take time before you see results, so please persevere.